Good day, my name is Regina Parado, BSN2 Weidenbach student. Administration of oral medications. It is the giving of medication to be swallowed through the mouth. Assessment. Assess the appropriateness of the drug for the patient. Review medical history, allergy assessment, and laboratory data that may influence drug administration. Assess the patient's ability to swallow medications. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. If the medication may affect the patient's vital signs, assess them before administration. If the medication is for pain relief, assess the patient's pain level before and after administration. Objectives: to ensure that patient metabolize medication without feeling of nausea or vomiting, to offer the most common, easiest, and less expensive route of administering medication, to provide a sustained drug action and increase absorption time. Gather equipment, check medication order against the original physician's order according to agency policy, clarify any inconsistencies, check the patient's chart for allergies. These comparisons help to identify errors that may have occurred when orders were transcribed. The physician order is the legal record of medication orders for each agency. Note the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder. It can also be used to educate the patient about the medication. Before proceeding to the next step, perform entry. Place medication on a tray or move the medication cart outside of the patient room. Are prepared for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent error. Explain procedure to the patient. This is to gain cooperation and to allay anxiety. Assist the patient to an upright or lateral position. Swallowing is facilitated by proper positioning. An upright or side-like position protects the patient from aspiration. Administer medications. Offer water or other permitted fluids with pills, capsule, tablets, and some liquid medications. Ask whether the patient prefers to take the medication by hand or in a cup. Liquid facilitates swallowing of solid drugs. Some liquid drugs are intended to adhere to the pharyngeal area, in which case liquid is not offered with the medication. This encourages the patient's participation in taking the medications. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside. Unless the nurse has seen the patient swallow the drug cannot be recorded as administered. The patient chart is a legal record. Only with a physician's order can medications be left at the bedside. After doing all the procedures, don't forget to perform handling. Check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of the effectiveness of pain relief and adverse effect of medication.